Your health on Daybreak USA.
Our time is 23 minutes past the hour, and our next guest is Dr. Peter McAllister, a director of clinical research, the Headache Center at Associated Neurologists of Southern Connecticut. Good morning, Dr. McAllister. Welcome.
Good morning, Jay. Thanks for having me on.
So, talking about migraines, there are migraines, and then there are chronic migraines. I guess first of all, what is a migraine? It's more than just a headache, right?
It's more than just a headache. So, 90+% of us have had a headache in our lives, but we can get about our usual activities. So a migraine is actually a genetically inherited neurological condition that causes profound pain and throbbing in the head, light and sound sensitivity, nausea, vomiting, dizziness, concentration difficulties, etc. What it really does, unlike the regular headaches we've all gotten, is it knocks you out of commission. And if you have a few of these per month, it gets awfully difficult, and we call that episodic migraine. And then there's the subset who are having, day in, day out migraines, 15 or more days per month, and we call that chronic migraine. And that one is the true disabler, where I've had patients in my practice lose their jobs, be unable to take care of their family, and really lose quality of time in their lives.
What is the average length of a migraine from when you feel it coming on till my wife gets them from time to time. She calls them the migraine hangover, to when they end.
Right. So, the throbbing pain, nausea, throwing up, that's usually, half a day to a couple of days. But then as your wife gets, a lot of folks have this sort of hangover, this wet dish rag of feeling slow, and then their appetite is off and their concentration's down. And imagine cycling through that multiple times per month, and it gives you a sense of this condition that, while it doesn't kill anybody, is one of the leading disabling medical conditions in our country.
You mentioned a couple of the things that set these off, sound, even certain smells will set it off. For women, does that the particular time of the month set them off as well?
Yeah, so, if you're wired for migraine, that is, if you have the genetic tendency, there are a number of triggers that can make a difference between, 1 or 2 migraines a month and 10 or 20 a month. Stress is the number one, actually. If you can reduce your stress level, you can probably get a handle on, or begin to get a handle on, your migraines. But the other big one is hormonal cycles. So there are some folks who have, the day before their menstrual period, they're almost guaranteed to have a migraine.
So now that we know what a migraine is, and a lot of people suffer from them, are there people that are misdiagnosed, by the way, that they are either told that they do have a migraine or that they don't, and then they just kind of go on about their lives, and they could be receiving treatment but aren't?
Yes, and as a neurologist and headache specialist, it's really frustrating for me. There are a lot of folks out there that are misdiagnosed, and common misdiagnoses are sinus headache, for example. A lot of migraineurs have a stuffy nose and a socked-in feeling around their cheek and eye, and they're diagnosed as sinuses. Some folks are diagnosed as needing their glasses changed, their prescription. There's a number of those. If you look at the chronic migraine sufferers, those with 15 or more headache days per month lasting more than 4 hours, up to 80% of those have not been diagnosed. And the pity there is, while we can't cure migraine or chronic migraine, there are treatments available that a headache specialist would have for them, and they don't even have access to them.
Our guest this morning is Dr. Peter McAllister, the Director of Clinical Research, the Headache Center at Associated Neurologists of Southern Connecticut, and Director of the Concussion Center. So what are the available treatment options?
Well, the first thing I talk about with my migraine patients is lifestyle. Some of the things we touched on earlier: decreasing stress, getting enough sleep, drinking enough fluids, avoiding certain foods, exercising. When you get to medications, there are some that can knock out a headache as soon as you have one come on, if you take it as soon as possible. And then there are medicines that reduce the number of headache days per month. For the chronic migraine sufferers, kind of the most interesting one when I bring it up to my patients is the use of Botox to reduce the number of headache days and headache hours per month.
Botox, the stuff that reduces wrinkles, right?
Right. So Botox came out for medical use since the 80s, and then in the late 90s got picked up because everyone knows about it because the movie stars and models are all getting it. But actually, Botox has a lot of medical uses, and one of them, since October of 2010, is to reduce the number of headache days and hours in people who have chronic migraine.
So how does somebody learn more about this? How can they get their doctor to understand what they're going through, I guess?
Well, there's a useful website, and I just pulled it up here as we were chatting, and it's called BotoxChronicMigraine.com. It's got a lot of useful information on what migraines are, what chronic migraine is. 3.2 million Americans have it. And then there's a little spot where you can put in your zip code, and you can find a headache specialist and someone who's familiar with or has expertise in using Botox injections to help reduce the number of headache days.
Is it injected like regular medicine or in the skin to help reduce wrinkles too, so you get a double effect?
Well, it's most of my patients coming in here are really bad off with their migraine. Their lives are on hold, or they're at risk of losing their job, or their family is quite frustrated. So they're not thinking much about wrinkles. It's injected around the wrinkle sites, but also on the side of the head, the back of the head, and down the neck and shoulders. So it's actually 31 injections with a very tiny little needle slipped under the skin.
And again, the website that you were just mentioned?
It's BotoxChronicMigraine.com.
Well, Dr. McAllister, we appreciate you shedding some light on this. I know there's so many people, my wife included, that appreciates it, and we'll send folks out to the website. Thanks so much.
Jay, thank you for your time.
You betcha. Daybreak USA. We'll be right back.